Approximately 2.5 million women in the United States suffer with heavy periods. This frequently interferes with a woman's quality of life by causing anemia and affecting family or social relationships, or causes work or financial difficulties. Medical management of heavy periods is often the first step. Anti-inflammatory medicines such as Anaprox or ibuprofen, starting a day or two before your period and continuing throughout the first few heavy days, will decrease blood loss and menstrual cramping. You should take these medicines each period. Many women will try some type of hormonal birth control to stop heavy periods. This may be in the form of a pill, patch, injection, or vaginal ring. By keeping your ovaries from ovulating, these medicines prevent excessive menstrual blood loss and cramping. They also decrease your risk of uterine and ovarian cancer, fibrocystic breast disease, pelvic infection, and anemia. Side effects of hormonal birth control include irregular bleeding, breast tenderness, headaches, or nausea. These are not common and will typically resolve after a few cycles of use. Another medicine is Lysteta. It is a non-hormonal pill that decreases menstrual blood flow. It is taken only during the first few days of your period, not every day throughout the month. It is not a form of birth control and cannot be taken with hormonal birth control at the same time. Risks are similar to hormonal contraceptives, including rare risks of blood clots in the legs or the lungs. It is a great option for patients who choose not to take hormones or a daily medicine. Another option is a progesterone IUD called Mirena. An IUD is a T-shaped device that is easily inserted into your uterus in the office setting. It is an excellent form of birth control, but also decreases menstrual blood flow with a low dose of the female hormone progesterone. There is a minimal amount of progesterone absorbed into your system, thus the side effects are extremely rare. You may have mild irregular bleeding your first few cycles, but this should resolve. Risks of an IUD, although very rare, include damage to the uterus, infection, and it coming out. It lasts for 5 years and is often covered by insurance. If medical management has failed or is not an option for you, there is a minimally invasive surgical option called endometrial ablation. This is a procedure where the lining of your uterus is ablated or burned. It is successful 90% of the time. Ablations can be performed as an outpatient in the hospital or even in the office setting. Very rare complications include bleeding, infection, or organ damage. Ablative procedures do not affect your ovaries, thus you will have no changes in your hormone levels. Side effects can include postoperative discharge or pain. Ablations are not a form of birth control and are not typically done in women who still desire childbearing, as pregnancy after an ablation may have increased risk of complications. The most effective treatment for heavy periods is hysterectomy, or surgical removal of your uterus. This is 100% effective, but also carries the most risk, as a hysterectomy is major surgery. There are now minimally invasive ways for your doctor to perform hysterectomies, including robotic hysterectomy or single incision hysterectomy. Your doctor may recommend you leave your ovaries if you do not have a strong family history of ovarian cancer, as your ovaries protect you from heart disease, the #1 cause of death in women. Complete recovery back to full physical activity may take up to 6 weeks, although many patients are back to work much sooner. I hope this information has been helpful. If you have heavy bleeding and cramping month after month, I hope you will seek one of these many treatment options that can dramatically improve your quality of life.